To welcome everyone to today's webinar sponsored by the Ohio AAP and CareSource, Vaccine Health, How to Communicate with Families in Diverse and Underserved Communities. I'm Kristen Fluitt, the Senior Quality Manager here at the Ohio AAP, and we're very excited to have Dr. Lou Edgy with us today. Dr. Edgy, if you wouldn't mind to move to the next slide. I wanted to again thank CareSource, our sponsors for today. We are so grateful to them for all their support. And I also did want to give a reminder that while they are supportive of this educational effort, they do not influence the content in any way. And with that, I will hand it over to Dr. Edgy, who will introduce herself, give you a little background, and then get us started.
Thank you so much. Number one, for the opportunity, not only to be involved with this, but also to be involved with the bigger concept of trying to make sure that we get to the end of this pandemic with information and tools that can be used to help our communities. So I am from the University of Michigan, graduated in class of 1995. The majority of my career really has been spent training physicians, specifically in family medicine, and as part of that, taking care of kids as well. I'm currently the Associate Dean of Graduate Medical Education at the University of Cincinnati College of Medicine, and do some peer review for several different journals. I also accredit programs for family medicine residency for the Accreditation Council for Graduate Medical Education. I have nothing to disclose and will not be speaking about any off-label products. So the purpose of our talk today is to go ahead and make sure that we're familiar with 5 strategies to enhance communication with families. And specifically, I wanted to talk about how knowing your audience is extremely important. Number 2, anticipating their questions the best you can, translating science, combating misinformation, and amplifying your message. And then we'll go over some review of the access to resources that are provided by the Academy. So, number 1, knowing your audience. What we do know is that mothers are the chief medical officers of our families. In fact, according to CDC data, 79% of women pick the family physician, 77% make the medical visit appointment, and 59% make all the major health decisions for the family. We also do know that there are significant gaps that we see unfortunately, in this pandemic, that are divided along multiple different lines. So for example, if you take a look at what we have here, you can see that this is actually data from the Kaiser Family Foundation. But if you look at Democrats versus Republicans, 90% of Democrats have already gotten their vaccine and are comfortable with it versus 61% of Republicans. 65 and older, it's 86 versus your younger cohort between age 16 and higher. So there are significant differences, and I think it's very important to be able to go ahead and access data to understand how you have the conversations. Most of us don't like to talk about political differences, et cetera, but in this particular situation, we do end up having to have some of those tough decisions and tough conversations to know where people are coming from. Additionally, we do have, specifically with the rollout of the vaccine being available for those 5 to 11, the numbers break down a third when you think about the parents who say, yes, I absolutely will get my kids vaccinated as soon as the FDA had approved it. You have a third that are saying, hey, I'm just going to wait and see how things go with those early adopters who got the vaccine right up front for their 5 and 11-year-olds to 11-year-olds. And then you have 30%, 1/3 that are saying, there's just no way, I'm definitely not having my kids vaccinated. Also, as far as what are the concerns that parents have, the long-term side effects, the long-term effects, the impacts on fertility, are the biggest things. And in fact, and we'll talk a little bit more about some of these concerns that parents have. I think the fertility piece is very significant. And essentially, parents don't want to hurt their kids. They want to make sure that they don't hurt them by not giving the vaccine, but they also don't want to hurt them by giving the vaccine. And so trying to understand where they're coming from with respect to that. We also do know that there is a difference in low-income parents versus high-income parents as to their comfort with their 5 to 11-year-olds getting vaccinated. So for the high-income parents, you have fewer people who say they don't know enough about the vaccine versus the lower income parents, a little bit more concerned about, hey, we don't know enough about it. As far as being concerned about side effects, again, lower income parents are a little bit more concerned about side effects than the higher income parents. Will it affect their ability to have kids in the future? Again, lower income parents are more concerned about that. And then will their patient be required and will it be a mandate? Again, lower income parents are a lot more concerned about mandates. And again, this is by Kaiser Family Foundation data, which is they check and report on a monthly basis what the sentiments are around COVID. So something is very interactive and something I definitely recommend you Googling and checking out on a periodic basis. Also, if you look at the children who are between 12 and 17-year-olds, nearly half of parents say that their 12 to 17-year-old has gotten the vaccine, but about 3 in 10 say they won't get their teen vaccinated. And it's interesting because we start to see that people who are in that age group with a little bit more autonomy, still children, still under their parents' roof, some of the teens are the ones driving the conversations with their parents to say, hey, listen, I know you don't want to get vaccinated, but I do. So being cognizant of that. Next, to try and anticipate their questions. And some of this is from the literature most recently, but then also these are questions that I've also heard. But the general concept is, as I mentioned previously, that folks really want to know, is my action or inaction going to harm my child now or in the future? Are they going to look back on me and say in 20 years, okay, now I can't have kids, Mom, thank you for not, doing X, Y, or Z. And then they do want some reassurance that they will not have regret. And again, science can help to answer some of those questions. So the common questions, most common ones in the past 2 to 3 weeks that I have received are, if COVID is mild in most kids, why vaccinate? That's one, and we'll talk about these individually. What are common side effects for kids? And what kids are at higher risk and should get vaccinated as soon as possible? And so if COVID is mild in most kids, why vaccinate? Let's tackle that one first. Number one, the vaccine is safe. And while Pfizer has been approved for 5 to 11, it is actually 1/3 of the original dose that was given for dose 1 and dose 2 for those over age 12. It is 91% effective in 5 to 11-year-olds, so it's safe and effective. We have around 700 kids who have already died of COVID. So that in itself is a chilling reason to go ahead and get your kids vaccinated. Also, the FDA has a prediction model that for every 1 million kids vaccinated, you prevent 58,000 cases of COVID and the potential long-term side effects of COVID as well that we're still starting to see come forward. One of the big concerns that we have is in kids who are sitting for the SATs and ACTs and things like that, some of the neurological components of taking those standardized tests being a concern. Also, it would prevent, again, if 1 million kids were vaccinated, prevents 241 hospitalizations for severe COVID and 77 ICU admissions. And if you think again about an ICU admission, that is cost to the family, that is disease burden that the patient is having to bear. That's also time away from work, which are uncalculated costs that parents have to sustain. And then also, vaccinated kids don't have to be quarantined. So if I'm a parent and I'm thinking about the practical component of it, if you have a kid that's been vaccinated and they have been exposed to COVID, you don't have to take unscheduled time off work, which again, for the lower income parents tends to be one that is a significant concern. What are common side effects for kids? Typically, these are going to be milder than the adults, but very similar. So fatigue, low-grade fever, so the 2 Fs. And then you think about muscle aches and joint aches, so the 2 aches. And then the last one would be mild headache. So those are the 5 major ones that tend to be an issue for side effects. And because mRNA technology, which is the technology used for both Pfizer and Moderna, The mRNA stays in the body only for a short period of time, so your side effects are usually going to be lasting about 48 hours or so, really at the longest end of things. It's a very unstable, so it breaks down very easily. That's why it's wrapped in a nanoparticle, a fat particle, so it's stable while it gets injected into the muscle. Of course, injection site soreness is not specific to this shot. That can happen with any shot that an individual gets. Another question, what are kids that are higher risk and should get vaccinated as soon as possible? Again, it's similar to adults. It would include patients who are diabetic, who are obese, who have asthma, who are immunocompromised, either because it's their primary immune state where they've been immunocompromised off the bat, or if they've got transplant or something like that, where there are medications that decrease their immune response. Also, to remember sickle cell, patients who have sickle cell disease also at risk. Additionally, talking about translating the science, and we'll just talk real briefly about this. I found that using analogies has been extremely helpful for me in getting some things across. So there are 4 major ones that I use: key in a changing lock, and we'll talk about each of these specifically, icing on the cake, safety deposit box, and Snapchat message. So first of all, key in a changing lock. And this is the one that I use, and I'll explain it for people who are saying, listen, I'm just kind of gonna wait. I'm not really comfortable. So that third of parents that are sort of sitting on the fence, I'm gonna wait and see. The thing that we get concerned about, and the reason that there's actually this timeline where you're trying to get folks vaccinated, as many as possible, is that if you think about the lock itself as a virus, the virus actually mutates. And while Delta is the predominant variant right now, if you think about this lock mutating and you think about the vaccine as a key, what you don't want to have happen is the existing vaccines no longer work in the lock because the virus has mutated so much. There is a Lambda variant that is in Peru, and the concern is that going to be the next variant out there? Well, if it does become the predominant variant here in the United States, will our Moderna and Pfizer vaccines actually work in that lock? Will those vaccines work? We don't want to have to start from scratch. So the more people get vaccinated, the sooner, so that we can go ahead and help to eradicate this before, or at least get it down to manageable levels before the virus continues to change. So again, you don't want to have multiple keys and multiple different vaccines that we're, again, adapting to and changing. Icing on the cake, this is for the vaccine was developed way too fast for me. So to this, you think about the fact that coronaviruses, SARS-CoV-2, which is the COVID virus, actually is a part of the coronavirus family. And we have been studying coronaviruses for the past 20 years. And so we do have a huge compendium of information about the effectiveness of vaccines and a lot of information on coronaviruses. And so at the beginning of the pandemic, most of the puzzle was already put together to get this vaccine. However, we did end up taking 66 days to go ahead and develop the information on the genetics for the spike protein, which helped us. And so I think of the spike protein genetic information as the icing on the cake. So each of the cakes there is a decade of information. All we had to do, we already had that at the beginning of the pandemic. All we had to do is find out the flavor of the icing and ice that cake. And so again, this was not something that was haphazard put together. This was something that had been in development and was already teed up and ready to go for the vaccine trials. And for the safety deposit box, this is for the I'm concerned the vaccine will affect my fertility. And again, if you go back to a couple of slides ago, that was one of the concerns that families had mentioned in their surveys with the Kaiser Family Foundation. So the one thing that we think about with that is that really the DNA to make another Lu is stored in a safety deposit box called the nucleus, and mRNA from the vaccine that's injected in does not have any access to the safety deposit box. And therefore my DNA, Lu's DNA, to make another Lu is not something that will actually end up being altered at all by having the mRNA injected into the muscle cells. And so, again, this should not affect your fertility in any way. It also is not going to affect, an unborn child. And we do find, in fact, that breast milk does contain antibodies. So a mother who has been vaccinated does actually confer some immunity to an unborn child. And then this last one would be a Snapchat message. Now, while I don't use Snapchat for the younger, again, knowing your audience, for the younger cohort of patients that you may be speaking to, when I say younger, being a family doc, some of my younger patients are 18 as opposed to pediatricians. That's the high end of things. The vaccine will have harmful effects on my body. And so to this is the issue, I think, of mRNA, again, as being transient in the body from the standpoint of the injection itself. So like a Snapchat message, it comes in, it stays only for a short period of time, and it's gone, just like a Snapchat message is. So it's there long enough to alert the body as to what antibodies to make, and then have those in reserve and ready, the next time it does encounter the actual real virus itself, and be able to address that situation. That is unlike COVID itself. So if COVID gets in, you have the problems of potentially long COVID symptoms and problems down the line. Combating misinformation. So this is really a significant problem. And the question is, how much time and effort do you spend on combating misinformation? I am on Twitter a fair amount. If there is information that is directly brought to me, or somebody is stating something directly in front of me, I will go ahead and combat that misinformation there and then. One thing that the Kaiser Family Foundation has done a very good job of is looking at news sources. And I think this is actually a very interesting slide. But again, it does show that there is a divide down political lines in some situations. But if you look at this graph, the news stations that are at the top of the graph actually believe more misinformation. The audiences for these particular news stations believe more misinformation than the ones lower down. And again, this is from Kaiser Family Foundation data done October 14th through the 24th of this year. So it's interesting to see. Now that may change over time, but that's the breakdown right now. So for example, NPR, 14% believe misinformation, CNN 11 versus Newsmax have 46% of their audience believing 4 or more false statements. Amplifying your message, I think this is extremely important, and I think that has helped me in many ways. For one thing, this is being recorded. That is one way to amplify a message. Getting connections to folks who can amplify your message for you, I think, is important as well. So catalytic partnerships is something that I have been trying to do all the way through the pandemic. And so community leaders, I have connected with several different companies here in town, health groups. For example, the Cincinnati Medical Association is an association of Black physicians here in town. And knowing that Black patients and Latinx patients were disproportionately affected by COVID, it was important for us to make sure that we did have individuals who look like them giving some of the messages, because we do know that from NAACP data that messages are received better from individuals who look like the patients. And so getting together with community leaders, local Black and Latinx physicians, faith leaders, so churches, also barbershops, local businesses, schools as well. So I've been on some forums with local school boards as well. And then primary care, where there's already an existing trusted relationship between a patient, their family, and the physician. Those are places to have conversations. Those conversations can be recurrent. So a patient may be a little bit closer to making that decision to have the vaccine or vaccinate their family, but may need another conversation down the line for that to occur. And so I have tried to meet folks where they are. So connecting with the Black community in particular, for example, Tropicana has several thousand viewers. She's on radio. Jen Michelle Lemon Kearney is a council member here, and she connects to radio stations and some of the DJs. So being able to connect again to a specific demographic of individuals has been something that I've done. On the right here, this is COVID's impact on our youth, and this is dealing with some of the school CPS interim superintendent being on and answering some of those questions there. Also, using social media to amplify the message. I had the American Medical Association actually had tweeted a story that I had been in the Moderna trial, which I have been for over a year now and will be for the full 25 months. But they tweeted a story and it got picked up by MSNBC. And so I ended up going ahead, and that sort of rolled out into all of these different areas that called and went ahead and wanted to talk about those issues. So reliable resources that I found, definitely the Ohio chapter of the Academy of Pediatrics website, and we'll look at that a little bit more closely in just a few minutes. I've mentioned the Kaiser Family Foundation Vaccine Monitor several different times, which gives us a national picture as well, and is focused primarily on the audience and what their thoughts are. Professor Peter Hotez, who is the Dean of Texas Children's, really has had a remarkable presence on Twitter in particular. Several thousand followers there, and then Center for Disease Control, of course, and the Ohio Department of Health. So looking specifically at our ohioaap.org up there, if you go ahead and go all the way to the right to the COVID-19 resources and click on that, it will show you for providers, for parents on the COVID-19 vaccine as well. And so if we click for parents, then you can actually get to this section right here, which is showing resources for families. And specifically, if you get to the immunization section, that will give you more information on COVID, and specifically COVID vaccine Q&A for pregnant women, also handouts and so forth, some facts and fallacies there. If you go to on the COVID-19 vaccine section and click on that, you can go ahead and have other resources that you can make available to other folks. Just wonderful graphics there and a lot of resources sponsored by multiple different organizations you can see there at the bottom, including Children's Hospital, Cincinnati Children's Hospital. Again, Kaiser Family Foundation Vaccine Monitor that I mentioned, Peter Hotez here. And then the one thing I really think is extremely important is just to make sure that we understand and keep the North Star. This, of course, was written before the pandemic, that life's most persistent and urgent question is, what are you doing for others? And what more relevance is this quote now in the middle of a pandemic than it was at the beginning? So that is all I had, and I'm certainly welcome to open up for any questions. I'm going to hand that back over.
Yeah, I think before we move to the last couple of slides, I just wanted to let everyone know if you have some questions for Dr. Edgy, we have some time left. So if you wanted to type those into the chat, she would be able to answer those. So while we're doing that, Dr. Edgy, if you wouldn't mind to go back just one slide.
Certainly.
Thank you. So just again, a reminder that this is one webinar in a training series sponsored by CareSource that we are providing. For those of you, many have registered for the next webinar in the training, which will be coming up on December 17th, and is Introduction to Lead and How It Impacts Environmental Justice. In our follow-up email from today, I'll include the flyer and the link to register for the additional webinars that will be coming up. So if you haven't done that, you'll be able to have easy access to that link. And then next slide, please. And again, this is just mentioning that next one in the series that's coming up. So please register if you haven't. We're looking forward to kicking off a couple of webinars around lead, which is a very important issue as well. And I'm not seeing any questions or comments in the chat. I just wanted to give folks one more opportunity to do that before we end things for today. Dr. Edgy, if you didn't have anything else or any other information you wanted to share.
No, I just, I don't want anyone to have any regrets. So, and there's no stupid question either. So please feel completely free. I'm happy to go ahead and be accessible to folks after this as well, and I certainly will stick my contact information in the chat. So please feel free to reach out if anything does come up. In the meanwhile, certainly feel free to reach out. What I don't want to do is to have regrets either. And so I will say that prior to the Moderna EUA coming out back in December of 2020, I did have family members who were lost to COVID. None since then, but the issue is I would have loved to have had the vaccine available. I think there is some question for folks who have sort of a global picture. Well, we are getting boosters, and this is, the third shot for a lot of us here in the United States. But what about folks who are overseas? We do know, again, to eradicate this completely, that we really do want to have the majority of the global population taken care of as well. And so for the low GDP countries, so low income countries, it does end up being about 2.5% of folks who've gotten one vaccine, which means that we are really seriously imbalanced as far as that goes. Of course, the US is doing some work to make sure that they can ship vaccines overseas as well. We have shored up enough vaccines here for everybody to get a third dose. So 38 million additional doses that are here in the United States. But we don't want to have those expire either, because then that's wasted vaccine. But again, I'm open to hear any questions from anyone, anything that comes to mind either now or later.
We do have a great question that came up in, do you know if this has been tested or studied on infants, or I'm assuming sort of children younger than that age 5?
Absolutely. And several months ago, our youngest patient was 8 months old. So there are vaccine trials underway right now already that have folks who are 6 months and above. And just a reminder, as a family physician, I'm giving shots to kids as newborns. And this is, again, not usually an issue for parents, and it's a requirement for a lot of schools to get in and so forth. So again, they do de-escalation studies, so decreasing the dose, see how they do with the older age group, and go down and down. So with folks between 5 and 11 having a third of a dose of the Pfizer vaccine, things would of course be lower for smaller dosing for the younger folks. But hopefully by spring we should have more information for those age groups, 6 months and above.
And a related question, and I know this gets into an area too that there have been a lot of discussions about recently, sort of the vaccinations for pregnant women.
Yeah.
Our question is related to breastfeeding. She's breastfeeding,
Yep.
and I think the baby is 1 month. Should she take the shot? And
Absolutely.
what are the impacts of, yes, I'm taking it, or no, I'm not taking it?
Okay, absolutely. Great question. And again, back to the issue of parents, not wanting to hurt their children. That is, as a parent, that's part of, your job, certainly. So the issue with pregnant women, COVID versus the shot. If you get COVID, you are much more likely to have complications, not only yourself during your pregnancy, but also your unborn child. Versus if you go ahead and get the shot, we do know that the antibodies, so your body's response to the vaccine, actually shows up in the breast milk of the child, meaning that your protection that has been boosted by your body actually is protecting your unborn child as well. And breastfeeding, same thing. You are transmitting breast milk that is a safety milk basically for that child, and you're giving a lots of benefit just from breast milk itself. But on top of that, the benefit that your body has already seen the vaccine and is actually acting like an umbrella of protection over the child through your breast milk too. So I absolutely say yes, get your vaccine. If you're pregnant, get your vaccine. If you're breastfeeding, that child can get protection directly from you.
Great. Thank you again. Great questions. Another question we have you seen more hesitancy toward other childhood vaccines because of the hesitancy toward the COVID vaccine? And if so, how have you addressed that with your patients?
So that's a great question. There's actually a bill here in Ohio that, they were really trying to say, okay, no vaccine mandates for COVID shots and no vaccine mandates while we're thinking about it for any other childhood related diseases. The concern that we have with that is that we have eradicated a lot of different disease states because we've got vaccine mandates for other smallpox, all of these other childhood conditions. So the concern that I have, I grew up, so I was born in Iowa, but I grew up in South Central Africa and did one of my second year of residency. I had a month that I actually went and lived in Africa and did some mission work there. And I got to see the end product of kids who hadn't gotten vaccinated for their measles, mumps, and rubella. Kids go blind, their eyes glaze, over, completely lose the color of their eyes, and death. These are things that happen when kids don't have the vaccines they should have. And it's, for some, it's because they haven't experienced it here, it's not as real as it would be as if you're seeing kids in the office overseas in certain areas. The Congo was where we were for a short spell, where they're having these diseases. So as far as hesitancy, I've not seen people say, I'm not going to get my flu shot because I'm concerned about where they were doing it previously. But we do end up having those discussions. Again, unfortunately, COVID got politicized, and COVID is much more deadly than the flu, and yet, and so that the vaccine has got such a potential to be such a lifesaver compared to even the flu itself. It's also much more effective even than the flu shot itself. The flu shot does its job, but as you know, the flu vaccine for this year is based on what the flu virus was last year. And so, the numbers that we got with the mRNA vaccine technology, so the effectiveness and all of that up in the 90s, unheard of. This is unprecedentedly successful vaccine. So.
And one thing we have heard from a number of providers, Dr. Edgy, is that children may be behind on their vaccinations because of things
Absolutely.
related to the pandemic. So
Yeah.
they didn't come in for appointments, or they were afraid to come in for appointments. So they may be kind of behind, and how important it is to get the word out about the importance of getting caught up on those immunizations and making sure your child has had those, making sure your child has had their well visit. Because there's very important screenings that happen during those appointments, and practices are safe. They're doing many things to ensure that patients are safe as they come in for appointments. So that's something too we really love partnership and getting the word out about. So I just wanted to mention that as it's related to childhood vaccines globally as well.
Yeah, absolutely. So that's a great point. And I think especially at the beginning of the pandemic, we noted parents are just like, I don't want to get my kid out into that crazy world of COVID. You don't know enough about it right now. I just want to be safe. I don't want to introduce my kids to a sick space where you've got sick kids that could potentially be having COVID. Most primary care offices have protocols around COVID, and they screen when somebody's calling in to say, I'm making my appointment, so that we don't have sick kids that are in the office, and then other kids coming in and potentially being exposed in the office. So that's one thing. The other thing is, when you're trying to do catch-up shots, you do want to know that, for our 5 to 11-year-olds, there's not any window to where, okay, you had this shot then, so you have to wait X number of weeks for that shot to happen. No, you can go ahead and get those shots, in the same session. And so, again, reassuring parents that they don't have to put things off any further. If, okay, I'm just going to get my regular shots and we'll think about the COVID shot, take that opportunity to go ahead and have that conversation that now is okay.
Right. All right. Well, I don't see any other questions, but as Dr. Edgy mentioned, and in our follow-up email, you'll have our email addresses. So if other questions come up, we're happy to be a resource for you. Your follow-up email will include links to the slides, links to the recording, and the resources, and even additional ones that have been mentioned today. So again, we thank you all so much for joining us. Thank you, Dr. Edgy, again, for a wonderful presentation.
Absolutely.
And we hope everyone has a great holiday week and everyone stay safe.
Be safe. Take good care. Thank you.
All right. Thank you. Thanks again, everyone.